Welcome to the Feeding Children module. This brief module is offered as a complement to early care and education college courses that cover health, safety, and nutrition. It is not meant to be exhaustive, but simply highlight important best practices and key information, as well as provide you with additional resources. We are going to cover these important topics that often come up when childcare providers are considering best practices for feeding children. These include feeding toddlers, common eating behaviors, the division of responsibility, and family-style dining. Many women choose to breastfeed their children beyond 12 months. Breast milk is very beneficial for child health and development and can continue for as long as both mother and child want to and are able to. This is supported by major medical organizations. The American Academy of Pediatrics recommends breastfeeding for up to 2 years or longer and continue for as long as both the parent and infant wish. The World Health Organization states breast milk is an important source of nutrition for children and suggests breastfeeding up to 2 years or beyond. Why is this? Just like infants, toddlers receive health benefits from breast milk. It contains vitamins and minerals, can help protect from illness and allergies, and continues to support the child's immune system. Nursing also provides comfort and security. Feeding toddlers breast milk from a cup at childcare is allowed and encouraged by childcare licensing and health departments. Breast milk can be reimbursed as a part of a child and adult care food program credible meal for children over 12 months of age. While you will still be assisting toddlers at mealtime, learning to feed themselves is an important skill that started with the transition to table foods. It is normal and important for children to be allowed to feed themselves and to learn this fine motor skill. Being intentional about the foods offered and the utensils given to toddlers can make the experience more rewarding for you and the child. It is also a great idea to set realistic expectations for what children can do, and especially allowing them to make a mess. If you are the type of person who has a hard time with messes, consider developing some mealtime strategies that allow you to relax and enjoy this incredible learning time. Your ability to stay calm and relaxed during mealtime helps the children also stay calm, and this opens learning centers in their brain, which they need when they are learning how to feed themselves. As young children grow and develop, allowing them to have an appropriate amount of control and choice in their lives is healthy. Applying the concept to feeding in mealtime is just as important as applying it to other domains. In the infant feeding module, we introduce you to the concept of responsive feeding. This can be extended into the toddler years by applying the division of responsibility in feeding developed by registered dietitian Ellen Satter. Adults and children have separate and distinct roles and responsibilities when it comes to feeding and eating. Adults provide the structured and supportive mealtime environment, which includes the foods, as well as the physical and emotional setting where children can be relaxed and enjoy the foods and the human connections. Children, on the other hand, are responsible for choosing whether they will eat any or all of the foods offered, as well as how much they will eat. In this way, we continue to build on the trust developed in infancy and support children in continuing to follow their internal hunger and fullness cues. This approach helps promote trusting relationship and self-regulation. As you consider how you will create a structured and supportive mealtime environment, please refrain from coercion, bribing, or forcing children to eat or even taste foods. This pressured strategy leads to stress and limits a child's ability to participate in learning about and tasting new things. When we think of toddler development, there are some distinct behaviors that often come to mind. These developmentally appropriate behaviors show up when it comes to eating in mealtime as well. Children at this age are learning autonomy, so it's uncommon to hear them respond no to many things. Allowing children to say no to foods, to have preferences, regardless of what those preferences are, including food jags. Allowing children to feed themselves and make a mess, and to continue to be welcomed into a meaningful conversation and connection at mealtime fosters their development. Offering children new foods many times and allowing them to refuse the food fosters their autonomy. Allowing children to express their preferences, which may seem silly to adults, but are serious business for children, also fosters their autonomy. Forcing children to taste foods or eat at least one bite of everything that's offered also undermines their autonomy and builds stress around mealtime. No matter the age of the young children you care for, remember, mealtimes are about so much more than eating food. Early food and eating exposures form the foundation for lifelong attitudes about food, eating behavior, and food habits. A positive and supportive eating environment is important for helping children establish all of these things in a healthy way. You can help children to be more accepting of new foods when you model healthy eating habits, offer new foods with familiar foods, and allow children some choices. Use descriptive words like crunchy or smooth, juicy or dry. Allow children the opportunity to ask questions and explore their other senses before putting it in their mouth. You can also compare the new food to familiar foods. You can say it's juicy like an apple, or it has juice and seeds inside. Let's cut one open to see what it looks like. You can also teach children how to politely get rid of a food they taste and do not like by offering them a paper napkin with a new food and allowing them to politely spit the food into the napkin if they really can't swallow it. This is a strategy to reduce stress and pressure for young children who are learning about new tastes and textures. When it comes to choosy eaters, the division of responsibility and responsive feeding strategies can be helpful. Adults should offer foods with a supportive and somewhat flexible structure, so children are able to choose whether they will eat the foods offered and how much they will eat, if anything. Here are some ideas. It's okay if children need a little encouragement during mealtimes. You can gently guide them to make healthy choices with positive words and by setting a good example. Be patient when introducing new foods. Children don't always accept new foods right away. Try offering them many different times and ways. Forcing children to try foods or bribing them with a reward like dessert reinforces poor eating habits, a distaste for healthy foods, and disrupts their ability to regulate their own nutritional intake. Likewise, offering foods as a reward for good behavior can lead to an unhealthy emotional connection to food and to overeating. The words you use to talk about food and encourage eating have a big impact on the way children view and experience food. Review this chart to see how you can change negative phrases to positive ones. Toddler food jags are common and often worrisome for caregivers. If you have never heard the term before, a food jag is when a child insists on eating only a single food or a few select foods. Because a food jag can last for a few days or even a few weeks, caregivers wonder if they allow the child to be so selective, will they ever learn to eat other foods? They may also worry that the child isn't getting enough nutrition. When caregivers continue to use the division of responsibility model, along with responsive feeding practices, most children outgrow this behavior. This division of responsibility means that we, the adults, continue to offer a variety of nutritious foods, even in small amounts, without pressuring or bribing the child to eat them. Adding pressure or bribing children at this stage creates more stress for the child and can lead to an increase rather than a decrease in food jags and picky eating. By sticking with your role, offering nutritious foods you would like the child to eat, along with support and a relaxed attitude, you can help children work through the food jag. Some strategies that might help are to offer the favorite food along with new foods, allowing the child to serve themselves and eating together where you can model eating a variety of foods can make conversation and connections with the child that include more topics than just what they are eating. This takes the pressure and the stress out of the mealtime and helps the child access the learning centers in their brain. Offering children limited choices fosters their autonomy. By limiting choices, we mean narrowing down the universe of possibilities for them to make the choice easier to manage. Remember, we are trying to reduce their stress around food. So rather than asking, what would you like to eat? It may be easier for the child if you ask, would you rather have apples or pears for snack today? If the child is experiencing a food jag, this can be a little more difficult, and you'll need to add some nuance to allow the favorite foods to go along with some new choices. This could be a yes to allow the child to have their favorite applesauce, but also let's put some apple slices on the table as well. Also keep in mind to offer foods that are similar nutritional value, so the choice doesn't always lead to the child eating a less healthy food. It will be hard for green beans or peas to win over cheese crackers, for example. In the classroom, this may look a little different for families if families are providing the foods. Allowing the child to eat the food sent for them by their family in any order fosters autonomy. It can be challenging for adults who are concerned about the child's nutritional health if the child chooses a snack or dessert first. But it's important not to put pressure or requirements on children and to examine why we feel it's important for a child to eat a sandwich first rather than starting with their cheese stick or apple and enjoying their meal in the order they choose. When families are responsible for sending in meals, there can still be lots of learning happening, especially when children learn about each other's food cultures and family life. Sitting with children to share a meal is still important. You will need to offer assistance opening containers or packages, preventing sharing when it's not appropriate, and of course, fostering conversations and learning. Since the foods provided by the family should also follow the Child and Adult Care Food Program meal pattern, many families may appreciate tips and tricks for packing affordable, easy, and healthy meals for their preschoolers. Some tips and tricks for fitting in the required food groups, appropriate serving sizes, and strategies for saving money may be useful and well received. It may also be helpful to include in your policy and parent handbook resources, along with the expectation for meal pattern and serving sizes, any foods that are not allowed, such as those that may pose a choking hazard. The facility must have foods available to offer as a supplement if the meal sent from home does not appear to meet the current USDA CACFP meal pattern requirements. If the food provided consistently does not meet the nutrition or food safety requirements, the facility should provide the food and refer the family for consultation to a registered dietitian, to the child's primary care provider, or to community resources with trained registered dietitians. Many child care providers rely on families to send in the food for their children's meals and snacks. We want to encourage you to consider the benefits of providing meals and seek out solutions such as the Child and Adult Care Food Program to assist you through meal reimbursement with covering the costs associated with providing food. There are many benefits to children when they eat in group settings and are eating the same meal. For some children, they are more likely to try new foods when their peers in childcare are also trying the new foods. You can also offer a well-balanced meal which relieves a burden for the families, whether they are busy or lack adequate food resources. Remember that not all families have the same access to healthy foods. For example, families may be challenged by living in an area without grocery stores, or have limited transportation to get to the grocery store, or have limits on how many groceries they can carry home while using public transportation. Families may also experience homelessness or food insecurity, meaning they may not have enough food or may not have it when needed. As a provider, you have the opportunity to share materials and resources to help families experiencing situations like these. Take time to learn about resources such as food banks or community gardens in your area. Family style dining, if you're not familiar, is when the food is brought to the table in serving bowls all at one time for children to serve themselves rather than pre-plated in a cafeteria style meal service. With this type of meal service, some caregivers worry about passing germs. And while those are certainly possible outcomes, the learning benefits of family style dining are great. The possible downsides can be managed with some practice. The first strategy for making family style dining successful is to use child-sized serving bowls, utensils, and pitchers so they'll be more successful in serving the amount of food they want. Also, plan on spills and keep the cleanup supplies nearby. That way you won't have to leave the table and clean up will be a little easier. It is best practice to allow children to choose which foods they would like to eat and how much. If you have a child who wants to eat the entire serving bowl, you may need to reassure them that they'll be able to have seconds or thirds once all the children have a chance to get a first serving. You can help reduce contamination and spills by teaching children who are new to serving themselves with a hand-over-hand technique. Sitting at the table with the children is important so you can observe any potential contamination from wandering hands, as well as teaching children how to pass, share, and wait their turn. Family Style Meal Service offers tremendous lesson plan opportunities for child growth and development. You can see how using family style dining, even if it's only during snack time, can be a wonderful learning opportunity for children. Besides the nutritious foods that are part of the meal or snack, children learn fine motor skills, communication, and self-regulation. Children are more likely to try new foods when they get to choose the foods and dish them up themselves. They often eat more, which can foster healthy growth and waste less food due to the increased choices involved. Family style dining can be used as a healthy weight strategy as well. Letting children learn to serve themselves helps them start recognizing how much food they need based on their hunger and fullness. Children are also more likely to try nutritious new foods that they may have avoided otherwise, such as new fruits, vegetables, and whole grain foods, when they see peers and adults eating and enjoying these foods. Use the time that you spend eating with toddlers and preschoolers for nutrition education by talking about which foods are healthy and why. Their tastes, like sour, sweet, or bitter, and their mouthfeel, are they smooth or crunchy? This is also a great opportunity for reinforcing other areas of learning, such as numbers, shapes, and colors. You can also build trust and connection with children when you sit with them, share the meal, and engage in meaningful conversation. Strong relationships, as you know, are the foundation for children's growth and learning. Offer family-style meals can also help children meet important developmental milestones. The whole school, whole community, whole child model highlights the connections between health and academic achievement and promotes the use of evidence-based school policies and practices. The information in this module is based on a variety of sources listed. It highlights key points relevant to this topic, but is not exhaustive. We encourage you to take a look at them for more information and to share with families in your care. Thank you for joining us to review Feeding Children. This module is made possible by the Centers for Disease Control and Prevention and was developed in collaboration between the Colorado Department of Public Health and Environment, Colorado Department of Early Childhood, the Integrated Nutrition Education Program, Culture of Wellness in Preschools, Pikes Peak State College, and Front Range Community College.